Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
It's no secret that Barbados is home to some precious gems. These are gems who are old enough to witness the birth of the pop-up toaster and the shortwave radio. Yes, Barbados has some gems who were around when insulin was invented. In fact, according to World Population Review, Barbados and Japan share the distinction of having more centenarians in relation to population than anywhere else on Earth. That's quite a feat to celebrate, but the number of people living to 100 is a reflection of the aging population. And while we celebrate centenarians, there's one cold hard fact we can't ignore: the cost of health care.
Barbados is known life expectancy for men is 72 and for women 75. And we have the highest percentage of elderly persons region. And when we talk about an elderly person, the benchmark, as soon as you become 60, you can be classified as being elderly. So Barbados has the highest percentage of elderly persons in the region.
Most developed countries classify anyone aged 65 or older as elderly. In Barbados, which uses the United Nations standard, it's even younger. By 60, you're considered old hair. Ed Bushell is the president of the Barbados Association for Retired Persons, commonly known as BAP. The organization has 44,000 members, so Bushell is intimately familiar with issues facing the nation's elderly. He paints a bleak picture of modern health care in the country for that age group.
The vast majority of the population, the aged population, do not have medical insurance available to them. As a matter of fact, what happens with a lot of people is that while they are in employment, the companies usually provide medical insurance for them. But what they did not think about or we plan for that when the employment ends, the medical insurance ends. And therefore at 65 or 67, to go to get medical insurance is almost impossible. So what we've been saying to our members and other people was, maybe we need to have two sets of medical insurance if we can afford it. One, again, when you come these companies, you don't contribute to that. But you need that when you leave your employment, that you still have some medical coverage. So the earlier you can get that coverage, that additional coverage, the better.
And it's for this reason that the BAP president is pleading for a more compassionate and understanding insurance sector.
What we need in Barbados, we have a universal health care system, but we need one that really ensures that all people, everybody, have equal access to health, medical care with no out-of-pocket expenses. In other words, at the point of delivering the service, you should not have to pay for your pocket. So we got to talk about how we're going to finance that. The other thing we've got to do is we need to get some insurance companies to provide, and it's possible we are looking at, we're talking to some insurance companies to provide medical insurance for people who are 50 plus. And even taking some pre-existing conditions into consideration.
With healthcare costs beyond the reach of so many elderly persons, attention turns to ways of reducing costs. And Mr. Bushell suggests that the focus must be on prevention. But he admits that not enough time and energy have been dedicated to preventative health treatment.
We need to spend the amount of time and energy looking at areas of prevention. Two more simple, right there. And second most important, if not most important, is exercise. It is amazing what regular exercise we are doing before you and forget again that. Very simple. to be a barber is a big advocate of that.
Bushell speaks from experience. He's 75 years old and has been diagnosed with type 2 diabetes. But with determination and discipline, he was able to beat it.
I'm a living, breathing, everything of it. It was diagnosed with type 2 diabetes. And when doctors will put me on medication, they say, really? Yes. All you have to do is eat well, and exercise. And he took that very seriously. I lost 76 pounds, reversed my diabetes, cholesterol, everything. The push-up can do it. Anybody can do it.